Okay, last time. I tried to record this a couple times, but maybe it's because I'm late. It's late, but my brain I keep going off track. Um, I just, today I thought about an experience that I had, and I wanted to share it. As you know, I've mentioned it on my post quite a bit, that I am not empathetic, I'm an empath, and that I also have a level of telepathy and some mediumship, and some other like psychic stuff. I'm not going to get into all of it, but I just wanted to share an experience that I had. One person that comes through and has come through since her passing is Kelly Preston, and she I think it was like last year, and it's not that often that she does come through, but like I think it was like last year that she came through. I was still with my former doctor. I'm not sure if it was last. I don't know. It feels like it was last year, but I was with my former doctor, and I had requested to see a pulmonologist and also to have an X-ray done on my chest. And I also requested more asthma medication because I was out of it and I was becoming more like asthmatic, I guess. Anyways, she didn't do the referral for the pulmonologist, as far as I know. I never received any calls from anybody. And she did order the x-ray, and then I ended up putting it off. And that's when Kelly Preston came through and was warning me and like trying to impress that it's really important that I get this done, like I get the imaging done. And so like I promised her that I told her I was going to. I'm not sure I should say promise. I told her I would get it done, but I continued to put it off. And then I ended up aspirating on pizza that I was inhaling. I was eating it way too fast. And so I ended up in the ED. And then they did a CT scan. And they told me, everything was normal, like I was good. And which I believed everything was normal, I think. I don't know if I read the scan there or if it was a few days later. I keep remembering it as a few days later, but I don't know, I kind of have like these little glimpses of me. I'm not sure. But, because sometimes I read it while I'm in the hospital, sometimes I read it when I get home, or sometimes I read it like when I'm ready to, like, which is typically like a few days, sometimes weeks later. I just like to go over, all the test results again and what the doctors wrote and, excuse me, etc. And this particular time, I looked at the scan, like in the notes and everything, and they said that I had a polyp in my upper left lung. And, they didn't tell me that. The doctors didn't tell me that. But it was noted in the radiology report, like the imaging report. And so I researched that, of course, and learned that a polyp in your upper left lung has a higher likelihood of being cancerous or like malignant. And yeah, I'm still hoping it's not, but I did go to my doctor and I did ask her for another, like a referral to the pulmonologist. I did tell her I would like to have this polyp removed. And again, it went in one ear and out the other. I told her I wanted it removed and tested. And then I ended up having to go to a new doctor, and I'm not sure how much I told. I think I told her. I probably emailed her about it too. I'm not sure, as I typically try to. If I don't remember to say something or tell her something, I email it. But I'm not sure if I pressed on it that much in the beginning, because I was dealing with a lot of other symptoms and things going on. So anyways, I did talk to my doctor this last time, and I told her that I would like follow up image. I'd like to follow up on the polyp, and I told her that I was interested in having it removed and tested or whatever. Like I'd really, I think I told her. I'm pretty sure I did. And she said she sent the referrals over to the hospital, and they can't get me until like August. And this other place could have got me in on Monday, but they didn't end up sending the referrals because the medical assistant, I think, I don't know, they had some questions around. I had a question whether or not I should have an MRI done or a CT scan, because we were planning on a CT scan, but then I realized I probably needed an MRI if there was a potential of me having MS, and because I didn't have my spine done, and I'm not confident of the MRI that was previously done because there was a lot of deviations from the last MRI report. So yeah, so I wasn't sure if I should be doing both or whether or not an MRI, I mean, I think an MRI kind of goes through your whole, when you do your spine, it goes through your whole system. So I don't know. I wasn't sure exactly what would be the most appropriate. And then she also asked about ultrasound, and I let her know about the bumps, lumps that I have in my like soft tissue in my chest and my collarbone and every like stuff that is sometimes like tender, but I don't know. I in the past have been lumpy and bumpy. I guess I've got cysts on my arms that like basically like the skin on where the cyst is like white, and then there's a whole other like skin color like around it, and I don't know, like I just have lots of bumps and things, and then like the lumps in my neck on this side feel more like in the soft tissue, and I don't know, I just have lots of lumps and bumps and things. So some of it could be like, lymph nodes being swollen or something. I know that. Maybe I need to do some lymph node draining exercises. I was thinking about that today, that I need to try to schedule, like, I need to start trying to do like the bicycle again and do the lymphatic massages that I was doing, because that helps a lot. Anyways, first I I keep thinking of that, and so I wanted to mention that, like that's kind of in my mind whenever I, you know, hopefully there's nothing there, but she was very like insistent that I, have that scan. There's something, and there is something. Hopefully it doesn't turn out to be like a really bad something yet. Like, I mean, maybe it could be removed now and then it'll be, fine. And, but, yeah, for all like the, like, bad experiences I have sometimes with, people, there's so many people and spirits and a great spirit and like and my ancestors and people, there's good people too, I think they look out. So anyways, I'm not going to go on a tangent anymore, but I just keep rambling tonight, so I'm really tired and I need to go finish a few things before I can settle down. But I want to mention that because it's also another layer of like my conscious awareness, of there being something there, like that needs to be addressed, that that I'm being warned about. Like, and I didn't know, that there was a polyp in my lung when Kelly came to me. Like, it was, like I didn't know. I thought I thought maybe I had a lung infection or something. Because I was coughing, like it felt like I was having fevers, and then I was like low grade kind of fevers and like a lot of congestion and stuff. And so yeah, I didn't know. And so I know. Thank you. Thank you, Kelly. That's all.